Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. How is everyone? So today we start with our chapter 2, subject biomedical engineering application. We'll focus on the rehabilitation engineering. Right? If you look at this nice figure here, the instrumentation is fixed here. This is actually a device that can help a person who has difficulties in walking. For example, they cannot walk by themselves after an injury, back pain, or a certain operation conducted on the neurological side, so that it affected them, so they've lost the function of their legs. So this system will assist them so that it will help the patient to regain the strength. Okay. Our content will be focusing on rehab, the introduction of the rehabilitation, what is rehabilitation, the functions, and what is the usefulness of rehabilitation, and then a little bit on wearable monitoring devices, the types of the devices, the available devices, rehabilitation devices, assistive devices, and technology, types of assistive device. We will look at one example, which is a wheelchair. Okay, so in these figures, these are all the design of the system that have been used, like bionic eye, human hand interacting with the robotic hand. This is artificial heart. Okay, this is artificial heart, the two one of the earliest design of artificial heart, so they can do total heart replacement, and this will be placed inside the human body. And then this is the, like I said, the bionic eye. So what is the aim of rehabilitation? It's a process aimed at enabling person with disabilities. So we are focusing on the disabled people, how they can achieve and maintain their optimal physical, sensory, intellectual, psychiatric, and social function level. I mean, we as an engineer, we try to help them to gain back, so that they can be among the community back. So with their function, as they can also contribute, they can also perform well with the community. So if we say types of rehabilitation procedures for disorders, there are so many, but here I have selected few. So in rehabilitation, you can focus on cardiac, that means all the function on the heart problems. For example, a person who undergoes a bypass surgery, undergoes bypass surgery, or what we call any sort of surgery related to the heart, angioplasty, and some other stent operation, and so on. So for example, at the beginning, a person who undergoes the bypass surgery, they will not be able to accept that they have this kind of disabilities, for example, limitation in their heart. But so at the beginning, they will have some sort of mental, what we call disturbance. They will have mental illness and physical as well, so they cannot perform very what we call rigorous activities. So this all follows under the procedures of rehabilitation. They have to go certain procedures. So cardiac is one of the example. Then stress, kidney. Okay, some people, they go for kidney replacement, and some chronic kidney diseases, kidney failures, so they will undergo what we call dialysis, for example. So they need support in terms of their bodily function, like physical of the body functions, the strength and the ability to be functioning as before. Even though they are undergoing for dialysis, there are certain limitations to their daily activities, not like before. So now they will have to limit themselves while having this sort of medical treatments and so on. They'll have to limit their movement, their daily activities, and also their ability to perform extra works and so on. Others also considered as stroke. Stroke is also one of the procedures, rehabilitation procedures involved. Other than that, drugs, in taking drugs, for example, if a doctor prescribe a specific drugs for you, that means you sometimes people can accept that they, for example, they have diabetic or they have blood pressure. So some people, they will not accept, and so they will pass the medicine, they will not take the medicine. So this is also considered as a process where people will undergo rehabilitation procedures with certain advices, so that they can cope with the drug. They will what we call add this drug into their daily lives, so that they have a better life. Then cognitive, spinal cord, traumatic, vocational, neurological. So these are all the types of rehabilitation involved, and you can find the specific procedures for these disorders. When talking about stages, so there are 4 stages. It begins with preventive rehabilitation, and then it goes to restorative. So the first stage is we prevent, and then you restore, and then you have supportive rehabilitation, and the last is the palliative rehabilitation therapy. So let's look one by one the example. So for this the therapies, the 4 stages, I have choose the dental cases for to have a clear example on the 4 functions. For example, preventive rehabilitation therapy, the goals is to attempt to prevent avoidable deterioration in function. That means you try as much as you can to prevent the damages to occur to the person. For example, pre-treatment dental evaluation, dental care, dental extraction accomplished before minimum 1 month prior to radiation therapy. This is, for example, if a person has serious cancer, for example, oral cancer or mouth cancer, so that they will have to do this pre-treatment. So that means at the first stage we try to prevent as much as we can, so that the situation will not become what we call much more critical. So this is the first dental extraction process shown in the figures. Next, topical fluoride application for prevention of dental caries, oral hygiene maintenance protocols. That means you try to prevent radiation caries by using these fluoride and also oral hygiene maintenance protocol. These are the preventive steps. Then we move on to restorative rehabilitation therapy. That means, for example, you have any missing tools and any parts, right, in the mouth. So you try to restore them. Aim to return patient to a previous level of function. That means you try to, as much as we could, to bring them back to their original condition. The reconstruction plan uses the skill of the prosthodontist and oral surgeon. That means these are people who will involve to look at how they can maximize the loss in the mouth, so that they will try to include back the tooth which is missing, or any parts inside the mouth that's been damaged due to the radiation process. Okay, that's we try to restore. Right. In some cases, people are nowadays focusing on stem cell in restorative rehabilitation. For example, immunoreconstruction, where they use the stem cell to restore bone marrow. Bone marrow ni sel darah merah dalam tulang. Immune system following radio and chemotherapy. Sebab bila orang menjalani radio ataupun chemoterapi, apa yang berlaku ialah banyakkan sel ni mati, terbunuh ketika radiation. Kadang-kadang radiation tu terlampau lama, dan proses radiation tu menyebabkan banyak sel yang berhampiran, yang sel yang sihat pun terpaksa dibunuh sebab berdekatan dengan kawasan-kawasan radiation. Okay, another one is tissue regeneration. Ni kita ada tengok example dia previously. Long lasting replication, differentiation and multilinear potential. We try to replicate. Ni kita cuba gunakan stem cell untuk hasilkan balik sel ataupun tisu yang hampir sama dengan mana orang yang kita culture kan, sel yang daripada origin. So that's used for tissue regeneration. Delivery vehicle, cell-based carrier for drug delivery, for gene therapy. Yang ni ada juga kita gunakan stem cell ni sebagai delivery vehicle, yang mana dia yang akan membantu membawa supaya sampai sesuatu package protein, RNA, DNA sebagainya kepada sel dalam tubuh badan manusia. So as delivery vehicle. Okay. Next is supportive rehabilitation therapy. This is the next. The goal is focus on maximizing functioning, independence and participation in meaningful activities. That means we try to help the patient to regain back their daily activities. So by doing exercises, physiotherapy, that means, for example, this is the clip that they use. So that if they have a clenching jaw, maknanya mulut dia tak boleh dibuka, dia cuba bantu untuk buka semula. Another one is they have this terabyte jaw motion system. That means it's used to help to regain the function, so maximize the mouth function, right? Next is the last one is palliative rehabilitation therapy. Goal involves supporting people to adapt to and come to terms with irreversible changes in function. Terminally ill patient, maknanya kita memang confirm sekian-sekian orang ni dia memang ada penyakit demikian, yang memang penyakit tu kadang-kadang tak dapat orang kata apa, tidak boleh dipulihkan lagi, maknanya terminally ill. So kita cuba bantu support. Tengok gambar ni kan, maknanya orang cuba support, berikan dia semangat pada patient tu. Contoh, definition will be what is the vision? The work of all the professional teams to enable the dying person to live until he dies at his own maximal potential, performing to the limit of his physical and mental capacity with control and independence whenever possible. Maknanya orang tu kita bantu dia supaya dia boleh hidup seperti macam biasa dengan maksimum, orang kata apa, sesempurna yang mungkin, at his own maximal potential, performing to the limit of his physical, maknanya dengan physical yang dia ada, dia boleh orang kata hidup lagi, dan mental capacity, control dalam keadaan dia memang ada control and independence bila-bila masa yang diperlukan. Itu dipanggil palliative rehabilitation. So aim to maximize quality of life for patient, families. Multidisciplinary approach involve patient and family in care planning. Dia tak jadi kalau patient saja, tapi families pun kena terlibat juga dalam program rehabilitation. Optimize physical function and emotional well-being to highest extent possible. Optimize physical function and emotional well-being to highest extent possible. Emotional, physical function consistent with patient goals, priorities and limitation, holistic. Jadi macam mana saya kata tadi, dia involve patient dan juga family. Kadang-kadang patient pergi sendiri ke rehabilitation center, dapat nasihat, dapat counselling dan sebagainya, balik masih tak boleh nak hidup dalam satu community ataupun dalam keluarga dia sendiri. Contoh kenapa? Sebab keluarga tak melalui proses rehabilitation, tak dengar pun nasihat kaunselor dan sebagainya. Jadi balik keluarga tak faham. Keluarga tak faham, dia pun tak faham sebenarnya kenapa ahli keluarga dia yang sakit ni jadi macam tu. Berubah sifat dia, berubah cara aktiviti seharian di rumah. Jadi itu menjadi masalah. Banyak rehabilitation program ni tak berjaya sebab tak involve keseluruhan ahli keluarga. So ini adalah source daripada rujukan seperti di bawah. Right. So if people ask you what's the goals of rehabilitation, it's basically to maximize quality of life the individual, and then we address the individual specific need. Kita cuba fulfill apa dia punya specific need. Assist the individual with adjusting to an altered lifestyle. Maknanya kita bantu dia untuk dia adjust. Sekarang ni mungkin dia sebelum ni dia gunakan dua belah tangan, sekarang dia guna sebelah tangan. So macam mana kita nak adjust dia supaya dia ada satu life yang altered, beza sedikit, berubah. Be directed toward promoting wellness and minimizing complication. Kita cuba kurangkan komplikasi dalam kehidupannya. Assist the individual in attaining the highest degree of function, self-sufficiency possible. Ini kita cuba bantu patient tadi untuk dia terlibat dengan maksimum dalam kehidupan seharian dia dengan diri dia sendiri tanpa perlu bantuan pada orang lain. Assist the individual to return to home and community. Ini sangat penting. Bila dia dah bersedia, dia boleh pulang ke rumah sama dengan keluarga dia, dengan community. So kita bantu dia. Macam mana cara-cara bantu dia? Dia ada step dia dalam rehabilitation. Okay. Research on to improve the quality of life. Itu sebenarnya rehabilitation engineering. The example is banyaklah. Ni adalah few example. Robotics, improve prosthetics, development of new technologies, increasing sophisticated use of computers, VR virtual rehabilitation. Okay. Rehabilitation engineering means involve design, development of new innovative assistive device. Kita cuba come up with the assistive device with the latest technology. Development of new technologies and techniques for improved therapies that help people regain physical or cognitive function lost because of disease or injury. Disebabkan penyakit yang berlaku pada dia ataupun kemalangan, musibah dan sebagainya, jadi dia menghadapi sesuatu kekurangan dari segi fizikal ataupun cognitive function dia. Jadi kita cuba bantu dengan perantaraan teknologi. Okay, ini adalah satu contoh. Use of robot as therapy aid instead of solely assistive device. Intelligent robotics aids mobility training individuals suffering from impaired movement. Ini apa contoh? Tangan robot tu dipasang pada tangan untuk dia boleh grip, boleh pegang benda, boleh angkat, boleh contoh pegang pen, pensel, ataupun dia nak makan boleh grip tangan dia, pegang sudu dan sebagainya. So this one example. Dalam gambar ni tengok ada orang belakang dia berdiri kan, membantu orang ni. Pakcik ni dia sebenarnya dia tengah cuba nak tendang bola yang ada dalam TV ni kan, nampak. So he is actually trying to kick this ball. Jadi kalau bagi bola betul, dia memang boleh tendang kan, tapi tak sesuai lah dia, yang baik ni virtual. Jadi kadang-kadang virtual ni bila stage yang awal ni macam ni lah, dia tendang bola sikit-sikit, try score goal, berapa goal boleh score daripada awal. Contoh selepas dia sembuh daripada stroke kan, contoh sebulan dia boleh score 30 gol kata, jadi bulan kedua dah naik 60 gol, kemudian naik lagi 90, maknanya dah berapa banyak improvement. Dia boleh tengok graf bacaan dia. Bacaan graf ni yang akan motivate patient-patient ni untuk improve dia punya rehabilitation process. Jadi ni contoh game yang simple. Tapi ada masa virtual rehabilitation ni ada game yang mana patient ni dia boleh lari sendiri, dia boleh lari, dia boleh explore dalam hutan, lompat dan sebagainya. So yang tu lebih menarik lah, dia menarik minat orang yang melalui proses rehabilitation, berbanding dengan kalau kita cuba imagine, just try to imagine macam mana kalau person who's undergoing this rehabilitation process, dia kena berjalan je ulang alik dalam bilik, dalam bilik ataupun dalam ward tu, dia kena berjalan ulang alik, lama-lama dia akan bosan. Tapi bila interactive game ni, dia mungkin ada level 1, level 2, level sampai level 20 kata. Jadi dia boleh explore semua level tu dengan virtual reality simulation, so he can exercise for physical and cognitive rehabilitation. So because it's entertaining, provide objective measures such as range of motion, game scores that can be stored on the computer operating the simulation, and also later they can evaluate his performance. This is an area when for prosthetic kan. Prosthetic ni dulu kita pernah tengok kaki palsu ni berat sangat, orang nak pakai pun susah dan sebagainya. Tapi sekarang ni dah ada macam-macam improvement, sampailah ke yang macam ni dalam gambar ni. Agak-agak berapa berat prosthetic ni. Prosthetic ni kuat ni, tapi dia jenis mesh, macam ada rangka-rangka saja, tak ada isi. Tapi dia ni adalah yang dia cuba untuk mimic natural limb movement and user intent. Maknanya improve prosthetic. Kita dah cuba daripada dulu prosthetic yang berat, yang solid, sampailah ke yang makin ringan. Tapi dia makin ringan, tapi strength dia sama macam yang asal dulu, ataupun strength yang sama macam kaki manusia yang normal. Tu dia panggil improve prosthetic. Right, ini pun sama satu contoh use of computers, sophisticated computers. Maknanya ini kira kes-kes kemalangan yang berat lah. Maknanya dia memang tangan pun tak boleh gerak, apa kaki. Jadi dia terpaksa pakai headband. Dan headband ni dia akan baca semua sensori. Contoh dia punya blinking mata dia, ataupun pergerakan senses muka dia, mulut dia, ataupun dia gerak ke kiri atau ke kanan kepala dia. Dia akan explore dalam game ni. Itu pun lebih kuat macam VR juga, tapi yang lebih kritikal lah. Maknanya dia tak bergerak apa, dia hanya based on bacaan daripada head movement. Ini called severely impaired individual, so that dia ni boleh dipulihkan supaya dia dapat masuk semula dalam community dengan lebih confidence. Okay, this is called development of new technologies to analyze human motion, better understand the electrophysiological muscle and brain activities, accurate monitor human function. Ini contoh, ada satu robot, personal assistant robot datang. Dia akan datang pada katil patient tu, dia akan tunjuk bacaan dia. Daripada jauh dia boleh dapat bacaan temperature, BP, dia punya pulse rate, and dia punya apa semua important body signals lah. Okay, through the development of new technologies. Okay, wearable monitoring device. Kita masuk wearable monitoring device. It is really an important field dalam rehabilitation engineering, right? So banyak sensors ni, kalau kita pandai susunkan sensor-sensor ni, kita boleh bantu patient ni untuk dia melalui kehidupan seharian dia. Contoh, artificial hand capable of complex movement and sensation. Ni artificial hand, dia boleh pakaikan dia punya tali kasut dia. Maknanya kalau dia ni memang dah hilang sebelah tangan dia, artificial hand ni boleh membantu. Ni wireless tongue, dia untuk paralyzed patient. Maknanya ada orang paralyzed daripada pinggang ke bawah, ada orang daripada leher ke bawah dan ke bawah terus. Jadi kalau leher ke bawah, maknanya dia totally paralyzed, kepala je boleh gerak movement. Maknanya dari sudut yang benda yang paling objek yang organ yang paling banyak boleh bergerak ialah lidah dia. Jadi dia gunakan sebagai drive untuk pergerakan dia punya wheelchair yang attach dengan wireless sensor. Jadi dia boleh tengok pergerakan lidah, dia boleh pergi kiri ataupun kanan. Satu lagi smart environment technologies ni satu dia pegang lah untuk patient yang macam ada masalah kuat lupa. Dia banyak masa dia tak ingat rumah, tak ingat dia punya jadual tiap-tiap hari nak makan ubat, berapa biji, berapa jam sekali nak kena makan. Ni adalah satu sistem. Okey, ni yang dia pegang tadi tu, sistem tu. Smart environment technologies helping Alzheimer patient to bring back memories. Alzheimer ni dia boleh ingat, tapi dia kena ada orang ingatkan dia balik. Tapi banyak masa dia lupa. Sebab tu dia ada macam recording system, memories, playlist, contoh sound ataupun song, satu suara bunyi tu kan, bila dia dengar dia akan teringat balik. Statistik, smart timing, lepas tu apa lagi, recognition song for visitors. Maknanya dia dah set, kalau visitors tu mainkan lagu tu, dia kata ni memang saudara dia. Saudara dia semua bunyi song yang macam ni semua saudara dia. Motion, muting down during conversation, light, tactile feedback, ini semua adalah lebih kepada dia punya sensory peralatan tu sendiri. Itu personalization. So easy to handle device for the patient. And then yang ni, bahagian ni adalah platform untuk family dengan caregiver. Maknanya dia boleh just send pakai smartphone aja. Dia punya sistem ni. Okay, these are few types of rehabilitation devices that being used nowadays. It is not what we call non-common item. It's very common. Exercise ball yang paling mudah sekali for stretching many parts of the body and promoting balance and coordination. Jadi tanpa exercise ball pun boleh buat exercise, tapi kadang ada orang ni masalah dia tak boleh duduk bawah. Jadi dia kena gunakan exercise ball daripada position yang sesuai, dia boleh buat exercise. Okay, first example. Second, exercise bike. Yang ni untuk patient yang recover dia punya kekuatan tangan dengan kaki, dia build stamina, so dia boleh buat exercise, plenty of running and so on. Isokinetic need to help patient build strength or recover from accidents. Jadi dia boleh gain semula dia punya loss of muscle mass and growth. Jadi dia boleh gunakan alat ni untuk buat exercise, dan at the same time dia boleh dapatkan bacaan berapa banyak dia punya strength improvement. Another one is Nordic track. Ini yang biasalah, smooth gliding motion make easy to perform necessary movement. Jadi contoh, dia boleh beli dan letak kat rumah dia sendiri. Dia boleh buat dia punya running activities dia tiap-tiap hari kat rumah kan, daripada dia nak pergi keluar ke taman untuk buat exercise, dia boleh buat exercise di rumah. So these are the types of rehabilitation devices. Another part dalam rehabilitation is also known as assistive device and technologies. So assistive device basically ialah kita cuba sediakan alat-alat ataupun we design certain types of equipments or system that can assist people to gain back their what we call daily life activities, their confidence, so that they can do the daily routines as before. So one of which we know is wheelchair, scooters. And wheelchair yang biasalah orang bawa wheelchair sama ada yang boleh tolakkan tangan ataupun ada orang tolakkan. Scooters yang ada batteries, yang ada joystick. Sekarang ni ada joystick kan, boleh kontrol kiri kanan, dia boleh bawa sendiri, perlu pada charging. Prosthetic devices, kitchen implements, peralatan dalam kitchen ni pun yang menggunakan assistive, maknanya sudu ataupun sudu sistem automatic page turners, book holders, adapted pencil grips. Ini semua yang perlukan lah kalau ada orang dia ada masalah tak boleh nak kalih muka surat buku. Jadi kita boleh design satu sistem untuk kalih page tu. Medication dispenser with alarm. Contoh, banyak orang yang ada masalah bila dah berumur dan dia telah melalui satu kemalangan. contoh dia ada terantuk kepala dia, ataupun dia ada masalah mudah lupa, jadi dia perlukan bantuan medication dispenser. Jadi kadang-kadang berapa biji ubat nak makan pun tak tahu. Jadi kita boleh sediakan satu alat yang boleh bantu release ubat, ikut timing dia, pagi berapa biji, malam berapa biji, dengan alarm. Jadi alarm bunyi, dia tahu okey, ni sekarang masa untuk makan ubat. Itu pun assistive device. Specially engineered computer programs, ni banyaklah contoh-contoh dia. Okey, wheelchair dia adalah assistive device sebab dia membantu orang. So, contoh orang ni dia mengalami kemalangan dan tak boleh berjalan sendiri, tongkat pun tak boleh pakai, jadi dia terpaksa duduk di sofa. Jadi macam mana cara dia? Dia sebenarnya tak juga keluar daripada rumah, pergi ke sana sini, ke dapur dan sebagainya, ataupun keluar daripada rumah. How we can help them? Just by using this wheelchair ni, so dia boleh duduk, pada masa yang sama ada roda, ada yang roda kecil dengan roda besar ni. Jadi gunakan tangan dia, kaki dia je yang sakit, orang kata tak boleh berfungsi. Jadi they can still move with the wheelchair. So memang sekarang kita nampak macam alah, wheelchair ni simple aja, tapi who came up with this first idea of designing a wheelchair? Kalau kita tengok masa tu, mestilah dia satu perkara yang orang kata memberi implikasi yang tinggi dalam kehidupan orang-orang yang disable ni. So wheelchair is a mobility orthosis. Properly prescribed wheelchair can be useful device to reintegrate a person with a disability into the community. Jadi dia boleh terlibat balik dengan community. Dia pun boleh pergi surau, boleh pergi sana, boleh pergi beli barang, terlibat dengan community. Tak adalah duduk kat rumah tak boleh bergerak, sebab potential of having this wheelchair. Okay, well-defined wheelchair fit correctly, cosmetic to the user, lightweight yet strong as possible, modified based on needs. Maknanya dia ni memenuhi keperluan lah. Ada handle untuk orang tolak, lepas tu kalau dia sendiri bawa, ada brake dia sendiri, kat mana ada brake dia boleh lock, tak bergerak. Contoh dia di satu kawasan yang slope, tiba-tiba takkan dia tak boleh pasangkan brake, kata tak pasang brake, wheelchair ni turun ke bawah bukit, habis dia terus ke bawah tu kan. Jadi satu masalah lain pula. Jadi dia mestilah user friendly. Contoh dia ada cushion dekat sini, kat tangan dia ni kan, tempat duduk dia ada cushion, jadi dia comfortable. Duduk pun ada span dan sebagainya. Ini ada apa? Ada bekas, ada satu bekas kan. Kalau buka ni ada, maknanya tempat untuk dia buang air ataupun kencing dan sebagainya. So dia satu sistem yang orang kata friendly. Dia tak payahlah nak bangun pula, nak pergi sana, nak buang air, tak boleh, masalah lain. Lepas tu ada tempat untuk letak kaki dan sebagainya. So is modified according to the needs of the patient. Okay, so ini adalah just dia punya person who's involved, right, in terms of prescribing the wheelchair. Okay, this is just to show the basic manual wheelchair parts. Maknanya ada banyak benda-benda yang telah ditambah. There are so many things, parts has been added to the wheelchair, so that it becomes a complete useful wheelchair which is user friendly. The bar, caster, brake, push ring, armrest, push handle, backrest, cushion, seat frame. So many components have been put into the wheelchair, so that it becomes a very useful system for the user, right? Okay, sampai sini saja. So we have completed the chapter on the rehabilitation. Hopefully is useful, and see you again in the next lesson, insyaAllah. Wassalamualaikum warahmatullahi wabarakatuh, and have a good day.